In this video, I will go over the clinical presentations as well as the treatment options for epiglottitis, croup, as well as the bronchiolitis. So here we have the respiratory tract starting with nasal cavity. It gets to the epiglottis, trachea, and then later on it gets to the bronchi, which will later on divide into bronchioles. So for this side, we have the bronchi, and then it divides eventually into bronchioles. So bronchiolitis, as the name implies, is the inflammation of the bronchioles. And these patients are usually less than 2 years of age, present with rhinorrhea, wheezing, and crackles, and the infection is usually caused by RSV virus, and the treatment should be directed at providing humidified O2 as well as bronchodilators or epinephrine. On the other hand, croup, the other name of which is laryngotracheitis, which means that it's the inflammation of the larynx and the trachea. So the first one, bronchiolitis, was here, then the croup in this area is presenting with the inspiratory stridor, hoarseness, and barking cough. And the main infectious agent is the parainfluenza virus, and it's usually causing infection in 1 to 2 years of age. And the treatment in these patients should be again similar to the bronchiolitis. You provide with the humidified O2 as well as epinephrine. Now, one other point I would like to mention here is that the inflammation of the trachea causes narrowing of the respiratory tract here, and this narrowing on X-ray is referred to as steeple sign. And then finally, we have the epiglottitis, which means that it's the inflammation of the epiglottis, which is most commonly caused by the Haemophilus influenza type B in patients 2 to 5 years of age. And this is a life-threatening condition because the inflamed epiglottis can block the airway here. And then on X-ray, this inflamed epiglottis has a thumb sign. So the appearance is like a thumb, and it's given the name thumb sign. And the symptoms include fever, drooling, and cherry red epiglottis on the laryngoscopy. Now, given that the inflamed epiglottis can block the airway, treatment should be started with intubation and then providing cephalosporin as antibiotics to fight back the Haemophilus influenza type B. So let's go over this table and summarize all the findings that I mentioned to you. So bronchiolitis is caused by RSV, is seen in less than 2 years of age, and in these patients it presents with rhinorrhea, rapid breathing, as well as expiratory wheezes and crackles. And then on X-ray you see lung hyperinflation. Croup, which is caused by parainfluenza, is seen in children 1 to 2 years of age. It presents with barking cough, hoarseness, and inspiratory stridor. On the X-ray, you will see steeple sign, and then both bronchiolitis and croup can be treated with humidified O2 and epinephrine. For bronchiolitis, instead of epinephrine, you can also use bronchodilators. And then on X-ray of the patients with croup, you see the steeple sign, which is shown right here. Next condition is epiglottitis, which is inflammation of the epiglottis, and thus as a consequence of which on the laryngoscopy you see a cherry red epiglottis. These patients present with drooling and muffled voice. The main infectious agents for epiglottis is Haemophilus influenza type B, and given that the inflamed epiglottis can block the airway, you will have to intubate these patients and then provide cephalosporin to fight back the Haemophilus influenza type B. And then on X-ray, the inflamed epiglottis has a thumb sign. So here is an example of thumb sign. So here is the inflamed epiglottis that has a thumb sign appearance. And that concludes our discussion.